Speaking of collaboration, there have been efforts, and there are efforts, and there is direction towards more of the scientific, modern scientific approach for Chinese traditional medicine. But from Western medicine, there's also some direction. There's also some movement towards this direction as well. You know, the system biology and traditional Chinese medicine is more targeted. So the whole notion of personalized medicine, at least on the kind of the top level, they're trying. You know, they're going towards the same goal. Do you see some kind of convergence, or is there a way to get the best of both worlds?
Yeah, I think that's is an intriguing question. With the cloning of human genome, there's more and more talk about personalized medicine, individual medicine, whether you can, based on a person's genetic profile, the unique genes for a unique individual, figure out whether a product, a medicine will work in that person or not, or what's the chance of developing adverse drug reactions to certain product based on your unique genetic profile. That's in a way similar to the TCM, traditional TCM approach. So the TCM doctor will take your pulse, look at your tongue, to give you a unique diagnosis, then develop a unique formula for you to treat your condition. So it's a similar approach, but I think it's intriguing for us to see how is there an area that the two research can merge. That remains to be seen.
Okay. One other topic. I mean, in theory, I believe in Chinese medicine. Yeah. I believe in, say, acupuncture, whatever. But the challenge is in its implementation. So it's very hard to tell, you know, which acupuncturist to go to, because of the slowness. It takes longer, and so you can't evaluate it very quickly. So you can't really. It's not very easy to tell, the practitioner or whether that pharmacy is giving you the right herbs. So it's in some ways it's hard to execute this, implement this. Do you have any views on how this can be dealt with?
Yeah, that's an interesting question. Because I spoke to one of the very famous TCM doctor. He was saying, when he treats the patients, so it doesn't matter how the treatment works, whether it's actually the treatment itself works or because of the placebo effect. If the patient feels better, that's all matters. So I think that's in a practical way. So if you have an acupuncture therapy and then make you feel better, so that's good enough as a patient.
Yeah.
Right. So I think that's to me is slightly different from evaluating an overall treatment regimen to demonstrate the efficacy. But on the individual level, if you believe a treatment, if it works, and that's good enough for that specific patient.
Do you have a favorite herb or a favorite medicine that you want to study more, or you just somehow are interested in?
Yeah, I think I like the TCM in general. I think the theory is very intriguing to me. Also, we look at the literature to study the evidence of the TCM product. It's a very exciting area. It's an old traditional area with a lot of Chinese heritage there. But I think it's very exciting to how we can bring the legacy theory and medicine to merge with a new era, to see how we can bring TCM to outside China. I think it's a very exciting challenge there.
Are there concerted efforts in doing this?
Not yet, but I see more and more TCM companies in China. They are, when we had meetings, they are very interested in explore the markets outside China, to, for example, the U.S. market, how they can go through the regulatory process to be approved as a new drug in the United States. I see more and more companies are at least planning on that.
Well, this might be a little too early, but when they do that, do you think they'll be branding it like a that it sounds like a traditional Chinese medicine, or are they going to brand in a Western-sounding brand?
Yeah, that's a good question. I'm not sure how they will do that.
Okay. Well, thank you very much. Thanks for spending the time with me.
It's my pleasure. Thank you for having me.